contribution to Ealing, the Ealing population, and how she has helped to support and serve the primary care transformation in Ealing over the last, well, it's more than 12 years, but certainly over the last 12 years in terms of the Ealing CCG and the Northwest London. But before we ask Mohini to say a few words, I'm going to ask some of her colleagues to come forward to say a few words. So first of all, I'd like to bring in Ramesh Bhatt, GP, a senior GP in NGP PCN, who's been a very close working colleague with Mohini. So Ramesh.
Thank you, Vijay. It really is a privilege to be asked to speak about Mohini, especially the first person to speak about Mohini. Mohini, you and I go back many, many years. We work very near each other, and we worked very closely with each other. I reckon we probably qualified at a very similar time as well. And for some reason, we have really just worked very closely together. We've had lots of interesting ideas we've shared together. And one of the things I recall is the meeting we used to have about community-based commissioning. And I think I still got some minutes from those meetings, which I've got in my loft. Which I do find rather precious. So I think a lot of what we're doing was prescient. It came to pass over the years. I remember participating in one of the first asthma, community-based asthma research project with Mark Levy, who you worked with. And so, you know, we have sort of evolved together. And in one or two of our sort of private conversations, I always felt that you sort of hid your light under the bushel a little bit. And I remember distinctly having a conversation with you about what else would you want to do apart from general practice. And you told me about your interest in management. And I was sort of saying, why are you sitting back? And I think the rest is history, really. And then, you know, you did participate and, you know, became a leading sort of person representing general practice and working closely with commissioners. I've marveled at your ability to work in teams. You have worked with, you know, very strong characters who come and go, who are commissioners and managers, and you forged a relationship between clinicians and managers, which is a model for others to follow. And you've done it with grace, you've done it without any rancor, and you have done with a smile on your face. And it has been a privilege to work with you. And I'm very sorry that you're leaving, but I do understand. As you said, to put your traveling shoes on. You have seen yourself through some personal difficulties and shown your resilience. And that's wonderful, as well as a professional person, to be able to keep your head above water with all the choppy waters. So thank you very much. And, you know, as Vijay has highlighted, I think your achievements are manifold, but I would highlight the Ealing Standard, which you steered through choppy waters again. And I, as you will expect me to say, I am particularly pleased that you involved the third sector before any other commissioner did. And I think that's absolutely fantastic. And the involvement of, you know, patient groups, people like Carmel, for example. And I think it's wonderful. So thank you very much. It's a personal note of thanks. However, I have also been asked to speak on behalf of the LMC, because the big beasts are not able to attend and they send their apologies. So in terms of the LMC, we've had lots of combative meetings, lots of friendly meetings, lots of smiles, occasional upsets. But that's because we care. That's because of your passion, and that's because of our passion as well. You've always been very respectful of the LMC that represents general practitioners, and I think the LMC would wish to acknowledge you bridging the gap, if you like, bridging the territory between management and clinicians, once again. And in particular, you have done it with charm, and you've done it with dignity and respect. And true to your name, you have captivated us. For those of you who don't know what I'm talking about, please Google Mohini and you will know what I mean. There aren't many people who probably understand what your name really means, but you are true to your name. And the person who gave you that name, Mohini, must be congratulated, because you have indeed been a Mohini. So thank you very much from the LMC as well. And we're all very grateful to you. And we wish you well, with great warmth. And please remember that you leave behind many colleagues who have the greatest respect for you. So thank you, Mohini.
Thank you very much, Ramesh, for your wise and kind words. I'm going to bring in now Philip Young, and some of you may know Philip. Philip is instrumental to Ealing CCG. He was deputy chair of the governing body. He was chair of the finance committee for the for Ealing CCG, and one of the key lay partners in terms of how we work together to ensure that Ealing CCG's clinical governance was above board in terms of how we provided care to the population of Ealing. So, Philip, over to you.
Thank you very much. Mohini, I have really enjoyed working with you over the last, I think it's 9 years. It's been a real pleasure. I have real respect for your passion for the health of the patient as at the forefront of everything that you have done. How you have always considered the patient angle in terms of how all the work is prioritised, undertaken. You have fought the bureaucracy, stifling many of the initiatives, and although frustrated at times, you have continued fighting the good fight against the bureaucracy seeking to stifle the health of the patients of both Ealing and North West London. And like Ramesh, we wish you all the very best, because none of us believe that you understand the word retire. And we know that you have already set up a number of other roles, each with having patient implications, and we're sure that they will continue to be a great success. Thank you for your inspiration, your leadership, and everything that you have done for the people of Ealing. Thank you very much.
Thank you very much, Philip. I'm going to bring in now Mark McKell, and I'll use Ramesh's terminology. He is one of the beasts of the LMC locally. So let's bring in Mark.
Thanks, Vijay. I don't think I'm one of the beasts. I think Ramesh holds a lot bigger muscles than I do, and Adam and Sid, but then Suk as well. They said sorry that they couldn't make it, but no, on behalf of the LMC, we just want to take this opportunity to congratulate you on your retirement and hope you get some rest, because you've been working extremely tirelessly in reforming the way that we deliver healthcare, sort of locally, more widely, even in secondary care. And we know your passion in sort of improving, as Carmel and as we've heard, your passion in improving patient care. The leadership's always challenging, so we've always had our LMC liaison meetings, and they've got fiery, and I think I've given Mohini a few grey hairs at times, but it's in leadership that always happens. We have challenging circumstances, but what stands out is that Mohini skillfully navigated us, so she's skillfully brought us to a place that we agree to be at. Her professionalism, her diplomacy, her strength of character, I think have really, I would say locally it's unprecedented, even across NWL. Examples such as the Ealing Standard. She was able to carve out a deal for us locally, which was tricky when you were dealing with NWL OOH contracts, and it set us and patients in a better place going forward. You've represented us at the top table at NWL, and you've handled quite sensitive and challenging issues with diplomacy that I think is inspiring to most of us, especially those of us who've come along a lot later in the journey. Another example is the nursing home services, which you managed to successfully implement in advance of the PCN DES. So, the Argyle group that managed to get that into a position way in advance of the PCN DES, and that shows foresight and skill in executing a plan that probably the rest of us may have not seen coming in a contractual way. I think what stands out for me in the LMC meetings, or the liaison meetings, is that you've always been open to our feedback from the LMC. You've always had an amazing ability to collaborate and to actually sit back and say, can you hear from the quieter people in the room? And as I said, the Ealing Standards, one example. A more recent example of success is the vaccination program with the federation and the pharmacies and the local services that have been doing this collaboratively. Mohini even came to the Dominion Centre on a Saturday one morning to see how it was all going, and had a walk around and spoke to patients. And really that's what Mohini's been about. She's been about sort of grassroots, trying to understand what is happening and taking that back up to the management level. I think a credit to Mohini's legacies that she's left us with a great borough team, Neha and Vijay and others who are always willing to listen and work collaboratively with the LMC. So on behalf of the LMC, I'd like to wish you all the best in your retirement, and congratulations, and thank you for your support.
Thanks, Mark. I'm now going to bring in Carmel Cahill, who is one of the other lay partners on the Ealing CCG, and she's been really instrumental in terms of the patient voice. She chaired our quality committee at Ealing CCG, and played a very active role in our primary care committee as well. So I just want to bring in Carmel to say a few words.
Thank you very much, Vijay. I've sort of been thinking about what I've been going to say since I first got the email from Mohini, because I was actually going to write it. But this has given me an opportunity to say something actually to Mohini, which I probably wouldn't do face to face. I wouldn't be here if it wasn't for Mohini. I've been in Health Watch when the CCG was set up, and at a very difficult time where I lost my chairmanship of Health Watch for standing up for what I believed in. Mohini spoke to me and said, would I apply for a lay board post that they hadn't been able to fulfill. I wasn't sure, I must admit, because it was to lead on quality, which wasn't something that I was extremely comfortable with at the time. I am now, though, I can assure you, Mohini. So that's been a big learning curve for me. And so I came in at the beginning of the CCG, and I'm an old dog, and they say it's difficult for old dogs to learn new tricks. But watching Mohini work has been such a joy. Her leadership, her empathy and inclusiveness, the knowledge she brings, and patience, which is something I don't have. And it's really interesting when you look at it from where we started. We started the CCG, God help us, with shaping a healthier future. the thing that has no name. We then moved through together, and we worked very hard, Mohini and I, on the maternity reconfiguration, and that was tough. Mohini is very good, you know, at keeping her enemies close, and this is what I say about inclusive. If you can listen patiently to those voices and talk to them early, you can actually make it much easier for yourself. And Mohini had that skill. We've then been through the various iterations of the CCGs coming to Northwest London and amalgamating, and it's all doing bits and pieces around Northwest London. And then God help us, it's ended COVID. So it's not, Mohini certainly hasn't had an easy ride in leading us and leading Northwest London at the end. But she's done it with such aplomb and with such grace. And speaking on behalf of the people, thank you, Mohini. It's been a great ride.
Thank you very much, Carmel. That's straight from the heart. I'm going to bring in now. I noted Harj Batoa's camera came on, so I'm going to bring in Harj, who some of you may know is one of the partners that the Barnabas Medical Centre has worked with Mohini for many years, serving the population in that area of Ealing. And so I'm just going to bring in Harj now.
Thanks, Vijay. It's nice to have the opportunity to talk about Mohini. And she's crying before I started. I think I might too. I didn't quite manage that last week to make her cry, but maybe today. It's been an honour, and she knows that, to have her as my partner. I was invited into the practice 20 years ago, and I think she has helped carve out my career and what I'm able to do. She has been devoted to the practice, and she has been a great mentor, I think, to everybody in the practice, but speaking personally, definitely for me. I think she's taught me how to be a leader in the practice, how to be professional, and how to keep the practice maybe ahead of the game and to develop it. I'm very glad she's taught me those skills now that I'm left without her. Really hope I don't run the practice down. She is amazing, and she will be missed. The way that she has developed that practice in the last, I'm allowed to say, Mohini, 36 years, is that what we counted?
Yeah.
I mean, I'm still a baby in comparison. I've only been there 20 years with her, but I think it's been amazing actually watching her going from being a GP with a young family to taking on these managerial roles that Ramesh talked about earlier, and seeing how she went from, you know, one job to another, progressing to where she is now. And it's just amazing what she's done in Ealing. I'm not sure, no disrespect to anyone else on here, that anyone else could really ever manage that in the way that she has. But yet still being very devoted to our patients and to the practice at the same time. That was never, you know, never a hat that she took off either, which we appreciated. Although, you know, we would always want her more in the practice. We were obviously fighting with the CCG for that. She's going to be very difficult to replace in so many ways, and she will be missed. But I'm sure we will stay in touch, and hopefully we will see her. Maybe some crazy Christmas nights out for sure.
Yeah.
Thank you very much, Harj.
Wish you well, Mohini.
Thank you very much, Harj. That was really wonderful. I'm going to bring in now Shankar, who, on behalf of all the past clinical leads that worked in Ealing and the present, to say a few words.
So first, I guess I just want to say thank you, Mohini. Like, you definitely changed my career. So back in 2000 and I think 10, 11, when first you gave sessional GPs a chance. Most of the structures of CCGs were not thinking of giving sessional GPs as salaried or locum GPs, but you created that opportunity for us to enter the CCG world. So that's a huge, huge thanks. The experience of being a leader, I mean, generally, like when you think of a group of clinicians, we always usually disagree, at practice level, whatever. But honestly, within the CCG group, I just felt that we never had egos, we never clashed. We really enjoyed working as a team, and that continued all the way through, even when there's change in that team. And I think the credit to that definitely goes to Mohini, and that's creating that style. You weren't micromanaging, you just let us get on with the things. You would tell us when we had to focus, when we got distracted, and you called us to order, but it was real pleasure. And like for me personally, I think that I find that I need to work with people that I respect and inspire, and you genuinely are one of the most inspirational GPs or people we've had the pleasure to work for. And I'm not just saying that, I think all of us as your team would say that. And the other thing I want to say is, and I'm saying this to all of us in this country, we know how you really think hospital doctors don't understand our life as a GP and that they don't understand our pressures. I honestly think none of you guys would, and including me, would understand the pressures that Mohini's had to deal with unless she did her job. It is just so challenging. And whenever I have a bad day in practice, I think, well, at least I'm not doing a day like Mohini, with all the really difficult conversations and decisions that you have to make and that complexity. And and Ealing, we've all made a huge benefit, and some of your leadership decisions, even making us jump from one group of collaboration with CCGs to another, thinking, why are we doing this? And then you just see the huge rewards and things that have happened as a result. I just want to say that, and I just want to say a personal thing on the flip side about just working in your practice. On the other side, so I had the opportunity of also having you as a boss as a salary GP at Barnabas, and I want to firstly say that you're absolutely a normal GP. Like, when you think about leadership GPs, you think, how are they clinically? And yep, sometimes they can be a bit crazy, but you're just like, you really, GP, I think you're just like any one of us in terms of like clinically and just getting it. You don't care about CCG pathways or politics. You just want to do what is right for that patient. I can still remember when we run into a room, we just think about, do we do this pathway? Do we do this? And it's like, just sort it out for that patient. Yes, maybe you had a few more contacts to turn to, but you just clinically keeping at the top of your game. And what I do think about your practice, and I would say this with Harj and everyone, was for me personally, I also saw how you managed to keep the traditional continuity of general practice, but still keeping it modern and trained. And I haven't experienced that in a lot of things. And you actually instilled that continuity wish in me as a GP going forward. So just want to say huge thanks to juggling all those roles and creating so much opportunity for your team and also for the patients of Ealing.
Thanks a lot, Shankar. Before I myself and Neha say a few words, and then I'd like to give the opportunity for anyone else on the call this evening that would like to say a few words. If there's anyone that wishes to do so. So I've got Bina. Bina's put her hand up. So Bina.
Oh, it's the only problem with working from home. The light, you never know where the light's going to be. Sorry. Yeah, I just want to say a few words on behalf of the CDs. Yeah, so from our point of view, all this stuff I'm hearing, I didn't even know that Mohini had done, but I've always thought Mohini's been an inspirational and supportive leader, and I'm saying that from a personal level as well as a CD. And of course, as well as being there for the start of Ealing CCG, she's been there to offer guidance and support from the start of the PCNs. And obviously, we've had quite an interesting start because we only had a year before the whole COVID pandemic started. We've had a great collaborative relationship with the CCG, primarily due to her initial leadership and her enthusiasm. She's been a willing listener, and she always responds to requests for help. Her patience has been exemplary, but it's always balanced with a call for action. At the start of the vaccination hubs, when it was complete chaos, we had a true collaboration with the borough leads and the PCNs, and she was the first one to roll up her sleeves and offer to come and help. That was despite the fact that lots of people were telling her that she shouldn't be doing as she was approaching retirement. But, she was brilliant, and she was there on day one. She's been a great CCG chair and a great NWL chair, and it's a shame to see her go. But we do wish her the best for her retirement.
Thanks a lot. I'm going to now hand over to Neha to say a few words.
God, that is a challenge to try and do that without crying this time. I've already said thank you twice to Mohini in the last few days, and every single time, I think everything that everybody has said has just been so warming to hear. I think you've really summed up Mohini's journey and leadership over the last however many years. She is an inspirational leader for us all, whether clinical or in a non-clinical role, as well as a manager. Mohini, I'm not going to say too much because I've said what I needed to say, but I just thank you on behalf of all of the CCG team as well, now and in the past as well. You have set the path for us, and I think we're a strong team, and we will just continue to grow from here thanks to your leadership. So thank you.
Thanks, Maxine. And before I hand over to Mohini, I just want to say, first of all, Mohini, thank you for picking the phone up about 12 years ago and to encourage me to become part of the Ealing clinical leadership team. That was a telephone call from Mohini. She rang me and said, you know, VJ, you know, this is a great opportunity for you, great opportunity for your own personal development, and she believed in me, and asked me to put myself forward. So a big thank you for that, first of all, Mohini. And really, for me, you know, all of us, you know, who've worked in Ealing CCG have learned so much from Mohini. You know, she is definitely inspirational. She's actually a superwoman when it comes to her understanding, her knowledge, her dedication, her compassion, her empathy, and how she delivers her communication skills, particularly in some very tricky governing body meetings we've had with the public. And we've had some very uncomfortable conversations in the past, and with her professionalism and her coolness, she has managed to divert and steer the conversation in the right way, and I've not seen anyone else able to do it as good as Mohini. Obviously, Mohini became North West London CCG, and quite rightly so. She was absolutely the right person for that role, and unfortunately, then I had to take on the role of the local chairperson, which there was a lot of apprehension from me to be able to fit into Mohini's shoes. But again, Mohini believed in me. She believed that I could do it. I'm still not sure whether I can, but that's where I can't even work out the agenda for this evening. So clearly, I still got some learning to do. But Mohini, I wanted to say personally, thank you so much for what you've done for the population of Ealing. And you've always said to us that we are here for the public. We are here for the population of Ealing. We are not just commissioners for providers. Our first priority is to ensure that we deliver the right care, the best care for all our population of Ealing. And we have, and I believe we have achieved that. A couple of milestones I really want to talk about. We've mentioned Ealing Standard, but there are a couple of others. London North West had a tight grip on community services in Ealing, and some of us were certainly unhappy in terms of the community services that they were providing, and we felt that we could do better, or another provider to come along and do something even better. And she steered, I would say, steered single-handedly the process and the procurement for a new community provider. And we supported her in that journey, and we are seeing how that transition has evolved and developed over the last couple of years. Another area I want to just pick up, and I think this is really important, we talked about SHAF and some of the difficulties of SHAF in the early days. And Mohini, I remember in trail finders, in fact, when I don't think I was I wasn't part of Ealing CCG then, and you had a very difficult very difficult meeting in trail finders, and there were a lot of people in the audience who were very sceptical of SHAF, but you used your integrity to manage that situation very carefully. And then finally, we've had some significant changes in North West London, which you have steered, particularly in reference to our maternity provision and our children's services, particularly in reference to acute care, and the sensitivities around how we did that, particularly in relation to the Ealing Hospital site, and trying to get really the public and the health professionals on board in terms of the right approach, the right belief, and the right desire to ensure that we have a paediatric service which was fit for the future. So thank you very much, Mohini. And so finally, just to say, we are really going to miss you a lot. That's unquestionable. What you have done for Ealing, no one would be able to, I believe, will be able to replicate that, certainly for a very long time. So thank you very much, Mohini. So I'm just going to now hand over to yourself to say a few words.
Yeah, thank you. Oh gosh, I haven't cried in 2 weeks, but yeah, Ealing is in my soul. I mean, yeah, thank you, Ramesh, Mark, Philip, Carmel, Haj, BJ, Shankar, everybody. Thank you for all your kind messages. It really is. It's been quite a journey. I remember I became a trainee in Mark Levy's practice, 1985, and we used to do joint alternate Saturday rotas with Ramesh's practice. So Ramesh taught me how to the bare bones of general practice, and we always felt that part of Ealing was a chicken egg sitting in Harrow and Brent, and we were never really part of Ealing. We were never really part of Brent Harrow, so we always felt a bit outlandish, and we started to think through in those days. And everybody has been absolutely brilliant. I think I've always said, as I said earlier, and is only as good as the team around one. And people have been absolutely amazing in all the help and support that they have given. I remember even just mentioning one when Kiran died. I mean, Neil was absolutely brilliant. Neil Crowley reached out, and Ramesh, and and of course my own practice as well. So but I remember when I was 14, I failed an exam, and my father sat me down and he said, "Well, girl, the harder the bounce, the higher the rise. So pull up your socks and get on with it." And that's been my motto right the way through. Yesterday's history, tomorrow is a mystery. It's only today you've got what you can do, and to do the right thing, and then manage the politics, not do the politics and then try and work out how I finessed it. That's never worked for me, I think. And doing the right thing, you go to bed with a clean conscience, and the rest will take care of itself. So yeah, I mean, I'm going to miss you guys terribly. But I woke up Monday morning, first day on leave, and I thought, how am I going to feel? But actually, it was, peculiar way. It was quite a relief in a way. You've had a good innings, and you think, actually, I'm leaving on a clean wicket. So I'm really grateful to everybody for everything. Immensely grateful, and thank you. I think you're all colleagues and friends, and it's a small place. The world's a small place, and hopefully, we will see each other as colleagues and friends. And I really wish you all the best in everything that you do, and all the best to Neha and Vijay to stay, because I'm sure you will all do the right thing. But really, all the best. You got to keep the Ealing flag flying high.
Thank you very much, Mohini.
Just to say that there are some lovely messages in the chat, as Mohini as well. So please do have a look from so many of the colleagues. And we've recorded this part of the council members, so we can share it with you, and you can keep it as a bit of a memory of us.
Absolutely, absolutely. Yeah. Ealing's in my DNA. So yeah, thank you.